virus is infecting and killing Black Americans in the United States at a disproportionately high rate.
The pandemic hitting the U.S. is hitting people of color especially hard, according to early data.
You can see African Americans represent 41% of COVID-19 deaths. The next closest race, Caucasian at 28%.
The absolute disproportionate impact that the coronavirus is having on African Americans.
Yeah.
In Louisiana, 70%, this is insane, of the deaths are African American.
Real life or death state of emergency. I'm calling out to the African American community to give you some facts. We are in a life or death state of emergency. 1 out of 10 Americans are Black. 1 out of 2 of the corona fatalities are Black. We are in trouble, my people. We have to come together. We have to communicate. They're not going to give us any time on the news. They're not going to come up with the solutions for us. We have to come up with our own solutions.
So today, Maryland released statistics that unfortunately confirm what we already knew about COVID-19 and its relationship to the Black community. Our people are contracting and dying from this deadly virus at alarmingly disproportionate rates than all of our other counterparts. And for a population of people who already experience repeated complex trauma day after day simply because we are born Black, one can only imagine the impact that this virus is having on our mental health and our emotional well-being. Therefore, I am here today to bring you some much needed mental health information, education, some self-intervention that you can engage in, and some much needed mental health resources when seeking professional help is imperative. So, therefore, let's get to it. Feeling some anxiousness or some sadness during this time is absolutely normal. Despite the normalcy of these symptoms during a crisis, they still suck. So I want to give you a few things you can do to engage in some extra self-care and help to cope with these feelings. I know most people think of self-care as going to get a massage or taking a vacation or just everything that we just simply cannot do right now, but there's so much more to self-care than that. So here are some ways that we can engage in self-care that we don't normally think about. First off, write at home and write in your living space. Keeping your space as clean and clutter-free as possible is so good for our mental health and our emotional well-being. Just the act of cleaning and organizing within itself can keep your mind occupied and not wandering and thinking about things that can make you feel anxious or make you feel down. You can also journal this experience and your feelings while in the midst of this historic event. This pandemic is nothing like we've ever experienced in our time or even in my parents' time, and especially not my children's time. Write about it. Journal how you felt. Journal what it was like to live in such a historic event. Put it away and you can look at it for years to come. You can also practice mindfulness meditation. The goal of mindfulness meditation is simple. You just want to pay attention to the present moment without judgment. There are so many physical health and mental health benefits that come from mindfulness meditation, such as getting better sleep, lowering your stress levels, and even decreasing your negative thoughts. And it's not that hard to do. Just 5 minutes a day where you are totally focused on your breathing can really help benefit you during this time. Another self-care exercise that you can use is simply listening to music and dancing like your life depended on it. Dance like you in the club. Have a good time in your house. Most importantly, it's so important that you don't forget to engage in conversation with your family and friends. FaceTime it, Zoom, whatever you need to do, but talk to them on a regular basis every day if you can. But what if these things aren't working? What if you've tried all of these self-care mechanisms and tried different coping skills, but you still feel really, really bad? Here are some signs and symptoms that you should look for just in case you might have a more serious mental health problem. If you start to feel long-lasting sadness, sadness that doesn't just last a day or two, but for 2 or more weeks, you might have a problem. You might feel irritable. You might have extremely high and low moods. You might be dealing with excessive fear, worry, or anxiety. You might have social withdrawal. Like maybe at one point you really loved talking to your family and friends, but now you don't even want to be bothered. You might have dramatic changes in eating or sleeping habits, like you're eating way too much or you're not eating enough, or you're sleeping way too much or you're not getting any sleep at all. These are all signs and symptoms that you just might be suffering from a mental health illness. So here's what you should do. Get in contact with someone right away. Organizations like Thrive Behavioral Health and Arundel Lodge service all of Anne Arundel County, and they accept medical assistance. They are currently accepting new clients and they are all using telehealth services. which means that they are able to give you therapy right over the phones. Spectrum Behavioral Health are for my people who have private insurance. They also are using telehealth services, and they are also accepting new clients. They are right here in Annapolis and service most of Anne Arundel County. Let me make myself very clear. At any point of time when you have thoughts of self-harm or suicidal ideations, which means you're really feeling like you don't want to live anymore, you have a method or you might have a plan, please stop everything that you're doing and contact Anne Arundel County Crisis Response at 410-768-5522, or if all else fails, please call 911. Your life matters to us, and it matters to you. We don't want to lose you. Last but not least, what if you have a loved one or a family member who is dealing with thoughts of self-harm or suicidal thoughts, and they don't want to receive the help and you just want to help them? Here's a couple of things that you can do. You can also call Anne Arundel County Crisis Response yourself, and you can ask them to go out to the home and try to assess your family member or your loved one. They can give further assessment to determine whether or not that person needs to be mandated to go to the hospital to receive further treatment. If all else fails, please call 911. You can let officers know that you need a welfare check to make sure that your loved one is okay. Also, please make sure that you talk the officers through. Let them know what your family, your loved one is dealing with, and let them know that they need to be addressed as an individual who is suffering from mental health and not a criminal. I know that these are trying times, but we are a community, and together we will get through this. And always remember that in great times of suffering comes resilience and strength. There's always something that's beautiful that comes from the thorns and out of the ashes. Love y'all. And don't forget to like this video if it helped you and subscribe to my channel. Mwah.